More than 20,000 NHS workers have begun another strike in the ongoing row over pay and conditions. Members of the UNISON, GMB and Unite trade unions are on picket lines across much of England and Wales. All ambulance employees, including paramedics, call centre and control room staff, not just emergency crews, are on strike. On Merseyside, at 2 Liverpool hospital trusts, midwives, porters and cleaners are also taking part. Unions argue this year's average pay rise of just under 5% isn't enough to stop people leaving the health service. However, the UK government says the strike action is hugely disappointing. Our health correspondent Dominic Hughes has more details.
The third strike day for ambulance workers from UNISON, one of 3 health unions taking action across much of England and Wales today. On the picket line in Leeds is Lyndsay. With 8 years of experience, she says this strike is as much about the future of the health service as it is about pay.
I have waited in corridors for 6 hours with patients needing urgent medical attention. It's demoralising, it's bad for the patient, it's not what patients should be doing. When they need an hospital, they should be in it. It's not fair to them. The government needs to have a realistic view of what we do. They need to put their feet in our shoes and see what we do and see what our patients go through.
Unions are calling for a 10.5% pay rise. The governments in England and Wales have given NHS staff an average increase in pay of 4.75%, as recommended by the independent NHS pay review body. That's currently half the rate of inflation. As with previous days of industrial action, the most serious and life-threatening calls will be answered. In fact, we've already seen a couple of ambulances leaving this station here in Leeds this morning. But there's no doubt this will also cause some disruption to the health service. Ministers describe today's industrial action as hugely disappointing and say talks about what is fair and affordable are continuing. But the head of health at UNISON, a key player closely involved in those talks with the government, says ministers could end the strikes tomorrow.
This is not efficient. You know, if the government is really concerned with efficiencies in the NHS, then the most efficient thing is to call off the strikes by adding extra funding to the NHS, boosting pay and talking to us about how to resolve the workforce emergency.